Hello, dear friends. Welcome in Homeopathy Canada live session. And today I just invited one of my friend, and we will discuss a very wonderful remedy, Rhus Venenata. And after that, I will show you some visual effects of this case, and after that we will discuss the whole remedies. So today we have one of the homeopath from Canada, Dr. Jessica here, and we will discuss this case. And after that, stay with me. So I will show you few rubrics, especially from repertory, so we can find out these medicines in our daily routine practice. So, welcome, doctor.
Hi, how are you?
Good, good. How are you?
Good, good. Okay, so you had brought up a small remedy. I know you're doing a series on small remedies, which was yesterday's post for Rhus Venenata. And I had a really interesting case that was very much relieved by Rhus Venenata. And so I thought I would share that today. So of course, many clients will come to us homeopaths with skin conditions such as psoriasis and eczema. And these types of conditions, I would say most of the time, are not a quick fix. But when you land on the right remedy or the right series of remedies over a period of months, you can really see a significant relief, reducing their need for topical steroids. And also for the clients who have these chronic skin conditions, sometimes it just gets so bad to the point where they're using biologics or more systemic medications that come with, a lot more side effects or a lot more issues. So if we can help our clients kind of alleviate their symptoms and clear their skin naturally with homeopathy, they're so much better off. So in this case, it was interesting. There was a young woman I was helping. She had approached me for eczema, and she had a history of eczema from birth, essentially, very soon after birth, and it was always predominantly around on the face, so around the eye areas, and then sometimes around the lip areas. It didn't really progress much because her physician always prescribed her a topical steroid. So she was used the topical steroid with success. But then she had reached out to me saying, is there anything we can do to support this holistically? I would like to try to, change my situation here. And I said, yeah, of course. So as a homeopath, one of the most important things I think it is that we should know is that when clients are coming to you and they have a history of topical steroid use, and I'm talking so for some individuals, they can be as sensitive as just using a topical steroid for 1 to 2 weeks. But for clients who have been using them for years or from childhood or every single season, there's something that you always risk running into, which is topical steroid withdrawal. That's a conversation for another day, but it is actually quite intense of a process. And there can be a lot of systemic effects that can come from topical steroid withdrawal, not only in terms of the skin actually flaring up and looking worse, and sometimes even getting to the point of bacterial infections, cellulitis, etc., but also systemic effects on the adrenals, sweating, temperature fluctuations, all of this stuff. So I as a homeopath, never advise my clients to stop their topical steroids without speaking to their prescribing physician first, doing their due diligence, and I just only provide the information. And we kind of can use homeopathic remedies to while they're kind of tapering off slowly with their MDs. Now, in this case, the patient spoke to their doctor. The doctor said, yeah, no problem. It should be okay because you're only using a little bit. And I believe she determined for herself that she would discontinue the use. So prior to that, she was utilizing the topical steroid, if I remember correctly, every day or every other day, just putting it on the spots. So when she came to me, The eczema itself wasn't really prominent. I didn't really see anything because, as you know, whenever we put on the steroids, our skin looks beautiful. And then as we stop the steroids, then the symptoms start to come out more. You get the redness, the flaring, the itchiness, and all of that stuff. So, based on her whole, so I took her whole case. Based on the whole case, the first prescription I prescribed was sulfur. The predominant symptoms for which I prescribed sulfur were because the patient was extremely warm-blooded, and also she would have flares within the winter, so her eczema always got worse in winter season. And also because there was such a significant history of suppression, which sulfur is wonderful for. Some people, some homeopaths, they're a little bit more cautious when they prescribe sulfur because sulfur can bring eruptions and things outwards. So for these clients, specifically with eczema or psoriasis or who are really bothered by their skin conditions, I usually recommend always, dosing at a low potency, very infrequently, and very specific to the client's sensitivity, and sensitivities not only in regards to their ailments but also to their remedies. Because, for example, I believe I started this client a single dose of sulfur 30C and said check in with me at the end of the week, and the first couple of days were good. By the end of the week, what had just been dryness and a little bit of redness around the eyes became full-blown facial eczema. So all around the eyelids, all around the mouth. She did have a history of like her lips tingling and swelling and itching, but never really like any skin eruptions around. Eczema all on the cheeks, and she also had a little bit of eczema on the hand, which was new this year. That was there originally, but it wasn't really bothersome at all. So after the sulfur, a couple of things happened. I do believe it was a true pushing out of the disease process so that the body is trying to clear all of those years of suppression. But I also believe it possibly could have been a combination of some topical steroid withdrawal for this client. Mind you, she stopped the topical steroids in the past and never had this. This was the first time her skin ever responded to this. So in my mind, I took this as though sulfur really, was pushing everything outwards and trying to support the vital force in healing the skin condition, the chronic skin condition. I dose very, very, I would say, moderately. So, a single pellet once a week, check in with me frequently, especially because she was so reactive to the first dose. This is the other thing with skin conditions. Like, if your client is very reactive, you want to check in with them regularly with skin conditions. I wouldn't just leave this client and check in 2 months kind of thing. Because it's sensitive for them too, right? They feel a lot. It's hard for them to go out in public sometimes. It's bothersome for them. They're uncomfortable. Like, if we can be there for them throughout the process, I think it's also helpful, right? So she continued to do well for a couple, I would say about 4 weeks. And then there was kind of just a stall. It was like everything came out, but nothing was really improving so much. Mind you, her mood improved. There was a significant improvement after the first dose on the mental sphere. So again, we know this is a positive reaction with remedies, because we know whenever, mental, emotional improves, even before the physical, that the vital force is, is doing what it needs to do. But now the client was like, okay, I feel good, but I'm not looking that good. So let's try to work more deeply on the skin. Now, what I was noticing as this time was going by, just with the sulfur, was the skin was looking very dry and parchment-like. So it was becoming very, very red. Like I would say crimson red, like very deep red. The skin was so thick, so dry. It looked almost like, I described it in my notes as like parchment-like paper, like parchment paper. This is what you would think. And all of a sudden, one of the unique symptoms that popped up was eczema of the lips, which her physician had diagnosed this in the past for her. Like, yes, this is eczema of the lips, but it was never this much where it was very, very dry, very, very burnt, swollen, red, everything like that. So I had to reassess her case because I felt sulfur was doing okay, but there was more to the story that I was missing. So I looked up the rubric face eruptions, eczema, lips, because I thought that it was strange, rare, peculiar that the eczema was actually on the lips. You don't hear of that often for people. Usually it's elsewhere on the body, right? Anywhere else. But on the lips, like the actual lips, is unique. And I found there were 11 remedies at the time. And again, as homeopaths, when we see rubrics with smaller amounts of remedies, that also alludes to the idea that this is a strange, rare, peculiar symptom, something we may want to be, zoning in on a little bit more, or that possibly we don't have enough provings in the other remedies. But, I took a look at the remedies that were in this rubric, and interestingly enough, one that stood out was Rhus V. And of course, I know Rhus Tox. Rhus Tox was actually my first differential between sulfur in the beginning of the case, but Rhus Tox is a chili remedy, and the modalities didn't fit the case. So then I looked into Rhus V for the very first time. It's a smaller remedy, never heard of it before. I was like, okay, let's take a look. And the data on it in the Materia Medica is somewhat limited. It depends what sources you go to. But the biggest thing that I kept noticing was that the skin was very dark red, and also that there was a specific modality where these skin eruptions or the symptoms of the skin are better with hot water. And I remember asking the client, like, how do you do after a hot bath or shower? Like, yes, her skin got a little bit red, but when she would wash her face with warm water, the itching and all of those symptoms she felt better. And I thought that was interesting because most people with, skin conditions say cold water generally will help them. And so based on what I had read in the Materia Medica, the skin dark red, the modality of better warm water. So I know in the Materia Medica it says specifically hot water. In this case, it was warm water, and that was enough to still be the correct simillimum for this case because what had happened was I had told the client, let's start with Rhus Ven, one single pellet again, just matched to her sensitivity, once weekly. And if you get any flares, because this is the other thing, her flares would so after she would take the remedy, the skin would get better, but then in a few days she would get like a flare, or she would sometimes take the remedy and then her symptoms would heighten, so a small aggravation, and then there would be an amelioration. So she was very reactive to the remedy. So I said, if you get a small flare, dose again on the flares and then keep it to once weekly. And I said, I'll check in with you by 4 weeks. By the end of the 4 weeks, I checked in with at this point, I felt like I was checking with the client. I was taking photos of the eruptions, everything. Although there was a lot going on, it was slowly getting better. The redness was coming down, the itchiness was coming down, her other symptoms were improving, but it was still there. At the end of the 4 weeks, the client, just 2 days shy of the 4-week check-in, said, my eczema is completely gone, except for a small spot on the chin. And even that is almost nearly gone. She sent me a picture and her skin just looked flawless, beautiful, like the best it's ever been. And I also forgot to mention, I knew we were on the right track with sulfur as the beginning remedy because the newest eruption, which was on the hand, was the first to improve. So again, we're working backwards, right, in terms of reverse healing. And so I said, okay, the hand is the newest spot. It's healing first. I expect likely that the eyes and the lips, which have always been there, will be the ones that will take the longest. And sure enough, that was the case. But with every single dose, so after the first dose of Rhus V, the client, I believe she messaged me and she was like, within 2-3 days, 15 to 20% improvement in the eruptions. I said, wow, we have a winner here. I love this remedy. So that we kept doing it once weekly. And I think I confirmed with her, did you need to take it during flares? And I don't think she had any flares. So during those 4 weeks, so I think she just stuck with it the once weekly, one single pellet. This was the most miraculous case for me because not only was the dosing, I thought, very infrequent, it was also just a single pellet. And you can see the reactivity of the patient after the dosing and after the remedy and through the progression. And, you know, when she came to me, she's like, how long do you think it will take? And I said, 3 to 4 months or 12 to 16 weeks. That sounds long, where I think we'll see some significant change. But it was exactly at the 16-week mark, 4 months, where she went from um, full blown eruptions, like literally on her entire face. I've never like she had never experienced anything like it in her history. So thank you, sulfur, even though it was bad at that time. But thank you, sulfur, because it really cleared it. Um, to literally flawless, beautiful skin, and then I checked in with her ironically like the winters that followed over the years, and I said, hey, how is your skin? Because you always want to know as a homeopath, like you never want to pry, but if your clients aren't calling you, it's probably because they're doing well or whatever the case may be, right? But you know, I checked in with this client. I said, like, how's your eczema been over these winters? And since the treatment, it's been so much better. Like it hasn't even been a thing. So it's like it really got to the root and the susceptibility of this chronic condition. And even though it's a little bit still remaining, or there could be a lapse in the condition sometimes, the frequency and the intensity at which it's recurring is also less. So again, deep healing from infrequent treatment that was years ago. And so, yeah. And so that was the case I wanted to share. A little bit about sulfur, a little bit of Rhus Ven dosing, and yeah, I mean, this is
So,
a powerhouse of a remedy. I really think more homeopaths need to learn and
well,
know this remedy.
absolutely, because many times because the sulfur is very very vastly approved remedy, and most of the
Mm-hmm.
times whenever we think about any eruptions, the first remedy which is come in our mind is sulfur,
Sulfur.
because because there are lots of eruptions, lots of things you can see in sulfur.
Mm-hmm.
But if the physician is keen, because there is a differentiation in the modalities,
Mm-hmm.
because many remedies produce, there are different kinds of eruptions
Mm-hmm.
improving. But if we focus on modality, as you says, amelioration by hot water,
Mm-hmm.
if somebody know what is the difference between hot water and the warm water and the lukewarm water,
Mm-hmm.
they will definitely differentiate the remedy.
Mm-hmm.
Hot water means if you cannot, if the tea is hot,
Mm-hmm.
if we prepare the tea, that tea is hot, and that hot water ameliorate Rhus Venenata. But
Yes.
if we see the modality of sulfur, sulfur ameliorated by cold
Oh,
thing,
yeah.
cold applications. The
Which
big
wasn't
difference,
really
even though one more remedies come here, is arsenic album,
yeah.
where there is a burning. Burning is ameliorated by a hot applications.
Mm-hmm.
This
Sorry, the other thing that eluded me to Rhus Ven too is because so if you read the Materia Medica, which I think you're going to be showing photos, but it has a specific word, erysipelas. So I was like,
erysipelas.
okay,
Uh,
old
wait,
school
wait,
Materia
I will show
Medica
you. I will show you the
language.
erysipelas.
Yes, and I looked at those photos, and that was almost a mirror image of the type of eczema that this client had. It's very dark, it's very swollen, it's, you know, all of this stuff. It's yeah, it's very prominent,
Yeah, this is erysipelas.
which is generally related to a bacterial infection. In this case, that wasn't it, but the way her eczema appeared kind of matched that picture. And for rust talks where you have hive-like eruptions where
Yes, yes.
they're a little bit swollen. So
Yeah.
ori- originally her eczema was just dry red patches, but then
Yes.
as we were starting treatment, it was changing. So I had to go with the changing picture because all of a sudden it started becoming like hive-like where it would come up, swell, and like circular patterns, and it would come and go, come and go. And I was like, okay, this is very rusty. So when I saw that Rhus Ven, I'm like, it also has that, and it's part of the species, but it's the most extreme. So it says the skin conditions of Rhus Ven are the most severe. And for this client, this is probably one of the most significant cases of like skin eruptions I've seen in that moment in time. So I felt that it matched quite nicely.
That's very, very good.
Yeah,
Very good. That's very
she
good.
was very happy.
Yeah. So I will show you because the doctor having a very less time because she has a client. So we will continue it. And whenever the client will be there. So we will continue the next study of Rhus Venenata. Yesterday, I will discuss few symptoms, but I just want to show today how they look like.
Hmm.
So most of the people who aged, they use dyes,
Hmm.
and I have seen so many times the people use dyeing, and after dyeing the hair, they have eruptions. So much eruptions around the face. I have seen one case where the person dyed the beard, and after that he has vesicle-like eruptions.
Hmm.
Vesicle-like eruptions. And if we see in repertory, we have only three remedies. So eruptions, especially head, hair dies from. So
Hmm.
we have only three remedies:
Yep.
Rhus Venenata, Mesodymium, and arsenic iodatum.
Hmm.
But if this eruptions is vesicle-like eruptions, fluid filled in these eruptions,
Hmm.
then we can think about Rhus Venenata.
Hmm.
So this is the remedy who having eruptions because of hair dye. And I just want to show the vesicle. If we see here, eruptions, eruptions, especially filled with serum, you can see only one remedies is there. So I will show you the picture of it if we.
And interestingly enough, too, at one point during treatment, I believe it was after sulfur, the skin on the eyes that started becoming red also started leaking a yellowish, thin, transparent like fluid. So it was becoming slightly vesicular in nature, but it was very transient in time. So that was also in my differentiation there.
So if you see here,
Yeah.
so this is the eruptions. This is also called herpetic eruptions, or this is called vesicle eruptions with fluid inside.
Hmm.
This is serum. Most of the time, if you read Rhus Venenata, the fluid will be yellowish in color. This is never be a green, yellowish, but a serum like, very, very watery, watery fluid.
Hmm.
You can see a wet, watery fluid.
Hmm.
And another symptoms of this wonderful remedy is swelling, especially behind the ear, especially shiny. Look at this. Swelling behind the ear, especially shining.
Mm.
Shiny eruptions. We have three remedies: conium, lyco, and Rhus Venenata.
Hmm.
And if you see the shiny eruption, sorry, swelling. It's look like this.
Mhm.
This is a mastoid bone. And any person having history of repeated coryza and ear infection, very frequently they have this eruptions. This is called mastoiditis. And if we see the x-ray of it, you can see that the air spaces are blocked because of that pus. Next, if we see here, is humming. And I will post one video of humming. So this is nose red, especially erysipelatous.
Mhm.
Erysipelatous. And I already show this picture here. So look at this nose. This is erysipelatous. Redness, absolutely red. And if we see, we have few remedies. Erysipelatous apis is the most prominent remedy, then lactic acid and Rhus Venenata,
Mhm.
especially discoloration red erysipelatous. Erysipelatous. And if you see here, okay, I will show you the eruptions first. So indurations. Eruptions elevated and indurations. Indurated. And I have seen these cases, and the person having this type of eruptions. Look at this. This is the eruptions where the pimple or the eruptions is indurated, hard.
Mhm.
And in this case, we can use Rhus Venenata. This
Mhm.
is hard, hard. And this is the eczema of the lips.
Yes, that's exactly it. But so my patient had something very similar, but I would say probably 10 to 15 times worse than that.
Yes.
Yeah.
So mostly this kind of eczema you guys can see in patient. And if you see in repertory face eruptions,
Lips eczema.
yeah,
I There's antimonium crude and meserium, which are the two other high graded ones.
yeah. So this is eczema, and after that, look at these symptoms. So itching ameliorate
Mhm.
Rhus Venenata. So we have the prominent remedy is Rhus Venenata, which is ameliorated by itching. But the biggest thing is here the eruptions cause pain, and the pain you can see burning here.
Yeah.
Itching amelioration, that itching produce pain, and pain is burning with the
Yes.
sensation of
Yeah.
burning sensations.
Yes, that was very prominent in this case.
So burning sensation.
Hmm.
But if the pain is ameliorated by itching, rubbing, then we have Rhus tox here, not Rhus Venenata. Rubbing cause pain, rubbing ameliorate the itching, but rubbing cause pain, and pain is burning like. But if the pain is ameliorated by rubbing, then we have a remedy, Rhus tox, not Rhus Venenata.
Also, I would think as a homeopath too, like sometimes, as you may try a remedy, may not have success right away, or you have a partial similimum or whatever the
Yeah,
case. Um, yes, so if you're thinking along the Rhus tox or the Rhus species and your case isn't moving so well, then you can look to the more smaller remedies of Rhus that we're not so familiar with, and that might be you know, the one that moves the case.
yeah. So one more symptoms, especially tongue, red center. If you see rustox, the tip of the tongue is triangular. Triangular red tip you can see in rustox, but if you see here in Rhus Venenata, you will see one very important tongue symptoms. And I have,
Yeah,
yeah.
red tip fissured in the middle. Vesicles.
So look at this. This is the red discolorations of the tongue. The other is white. And if the rust stalk is there, look at this. The tip is triangular and the tongue having a remark of the teeth. So, but the center of the tongue is red. Center of the tongue is red. And I just want to show very one more important
Yes.
symptoms.
I do have a client at 6, but I might sign off just in case. I'm saying bye just in case. If not, I
Yeah,
will.
yeah. Okay. The symptoms. Complained of cecum. If we know the anatomy of the abdomen, everyone can judge what are the complaint of cecum. I just want to show first. Okay. Okay. Yes. So this is cecum. This area is cecum. And what is here? Here is appendix. The complaint of cecum means a person who having a appendicitis. And this is confirmed by the another symptoms of this Rhus Venenata, because this is very important here. If you see, the complaint of the cecum is only having a four remedies: arsenic, lacusis, Rhus Venenata, and Veterum viridi. And if you see here, abdominal pain, especially umbilical before and during diarrhea. And if you see the appendicitis, the pain is at the same place around the umbilicus. It means this remedy is wonderful for appendicitis. And here one more rubric is there, especially of abdomen, especially in the back. Look at this. The pain in the back, especially lumbar region, extending to umbilicus. Umbilical region, because the if we see the appendicitis pain is always go back, and there is a lumbar region, and especially that pain is extended to umbilicus region. And if you have only two remedies, pronus and Rhus Venenata. Rhus Venenata. And that's it. One more very good symptom is here: cramps, especially back of feet driving the car. Because most of the time, most of the time, most of the time, who drive the car mostly using the feet, and during using these feet they have a cramps in the feet. So here the Rhus Venenata is also a very very important remedy. And as Dr. Jessica says, this person is ameliorated by hot applications. Hot means very warm water. If tea is hot, it means that much hot water that give ameliorations to Rhus Venenata. So this is all about Rhus Venenata, and we discuss one more very important thing I just want to show you is the swelling of the eyes. Even this remedy is also giving a very important rubric of swelling of the whole eyes. The whole eye, especially the right one. If the right one is involved and there is a swelling of the whole eyes, we can use this remedy. I will show you. So look at this. Face swallowing, eyes around, especially right. So we have two remedies, Elianthus and Rhus Venenata. So this is all about Rhus Venenata. This is a small remedy, but having a very prominent symptom. Most of the symptoms aggravated because of the heat of the bed. Itching in the chest, itching in the chest, pain in the chest is aggravated by warmth of the bed and ameliorated by hot water. Rubbing amelioration. Rubbing cause burning pain, and that burning pain is ameliorated by hot applications. So we are discussing small remedies, and Rhus Venenata is one of the most important remedy we can use in our clinical practice. Thank you so much.